Hey, you guys, welcome to day 29 of our March Madness practice questions. As always, I like to get into my introduction and disclaimer before starting on our questions. So, for those of you who are familiar with me, hey, y'all. For those of you who are new here, welcome, welcome, welcome. I am Dr. Brittany Weinstock. I am a family nurse practitioner and the founder and CEO of the Nursing Studio. I assist nurses as well as nurse practitioners with success on their boards as well as in practice. I have been doing this since 2015, assisting nurses as nurse practitioners internationally with exam success, and I would love to add you to the list of thousands of successful nurses and nurse practitioners. But before I get into the material for today, I like to always give my disclaimer. You know what it is, that there are no absolutes in medicines, and we treat on a patient by patient basis. So when I provide questions to you guys, it is based off the current guidelines that are being tested on the current exams of the ANCC as well as the AANP. And if I'm talking about things that we do in practice, I will talk to you and explain that so there's no confusion based upon the guidelines versus what we are testing on, okay? All right, you guys, let's get into question number one for today. All right, question number one states a patient presents to the office for follow up today. He has a history of anemia. As the nurse practitioner is completing her assessment, she notes the patient's appearance appears to have a beefy red tongue. While reviewing labs, she notes macrocytic normochromic. Oh my goodness. She notes macrocytic normochromic. Based on these findings, how should the nurse practitioner diagnose? And I'll read that one more time. A patient presents to the office for follow-up today. He has a history of anemia. As the nurse practitioner is completing her assessment, she notes the patient appears to have a beefy red tongue. While reviewing labs, she notes macrocytic normochromic. Based on these findings, how should the nurse practitioner diagnose? Is it A, iron deficiency anemia, B, thalassemia, C, B12 deficiency anemia, or D, folate deficiency anemia? Take a moment and tell me what you got in the comments. All right. You guys, I always recommend that you read the stem of the question first so that it allows you to slow down and ensure that you're answering what is even being asked in the question. So it says, based on these findings, how should the nurse practitioner diagnose? I always tell you assessment, diagnosis, evaluation, and treatment. So if we're looking for a diagnosis, we need to take it back and look at the assessment, see how they presented themselves. What are their signs and symptoms? What were the subjective findings? What were the objective findings, right? So the patient just coming in for a follow-up. He has a history of anemia. Nurse practitioner notes a beefy red tongue. Also, lab values showing macrocytic normochromic. Remember, I always tell y'all to be sure that you know those key identifiers of things. Beefy red tongue is classic with B12 deficiency anemia. And then the macrocytic normochromic lab values confirms that diagnosis. So your best answer choice is C, B12 deficiency anemia. Remembering B12 deficiency anemia as well as folate deficiency anemia are macrocytic normochromic. So their hemoglobin hematocrit will be low to let us know of anemia. And then as we go further to identify what type, so we know how to manage and treat this, it'll show that is macrocytic but normochromic, right? So the MCV will be greater than 100, making it macrocytic, and then normochromic, it will fall in that normal range of that 31 to 37, okay? And that is for B12 and folate. But if you struggle with anemias, go check out my anemia video, my 212 rule. But when I talk about these two in the larger scale, the macrocytic normochromic, B12 and folate, how do you differentiate between the two? I'm big on when you're studying, looking at the similar things, but knowing how to differentiate, right? And so B12, you'll have those neural deficits, those paresthesias. That beefy red tongue is very common, where you won't have any of that with the folate deficiency anemia. So again, C is your best answer. All right, question number 2, you guys. A patient presents to the office today for follow-up. He complains of a reddened area to his nose. Upon assessment, the nurse practitioner notes a pearly dome appearance to the location on the patient's nose. What is the best diagnosis? Is it A, squamous cell carcinoma, B, basal cell carcinoma, C, rosacea, or D, melanoma? Take a moment and tell me what you have in the comments. All right, you guys, stem of the question states, what is the best diagnosis? So, again, take it back to the assessment. So the patient comes in, they're complaining of this reddened area on their nose. As the nurse practitioner looks at it, she notes a pearly dome appearance to that location of the nose. Again, key description. What is that key description of? Pearly dome, you should instantly think B, basal cell carcinoma, right? You know my saying, like when I say this, you say that. When I say pearly dome, you should say basal cell carcinoma, right? All right. And then let's go to question number 3. Question number 3 states the nurse practitioner and NP student are assessing the patient's A1C. Today, the A1C is 12. The nurse practitioner student is asking the nurse practitioner when should insulin be initiated. What shows an appropriate response? Is it A, an A1C of 8, B, an A1C of 10, C, an A1C of 12, or D, an A1C of 14? Take a moment and tell me what you got. All right, stem of the question state what shows an appropriate response. So remember, we're talking about A1C, when to initiate insulin therapy, and this is a more knowledge based question. So when you're reviewing your diabetic stuff and looking at those guidelines, it still states that an A1C of 10 is a definite range that you need to start initiating insulin. Now, again, we treat on a patient by patient basis, but for testing purposes, that's that number that we're looking for initiation of insulin. All right, you guys, I hope you found this helpful. As always, be sure to like, comment, subscribe, and share with whomever you may think may find this beneficial as well. If you need any of our additional services of our online review, our review book, either the ebook or the paperback, or if you would like to join our 5-week intensive, today is the last day to enroll. Classes start on April 8th. So if you're trying to join us, get to it, get to it, get to it. We would love to have you. But also, if you need us for our one-on-one sessions to help you go from unsuccessful to successful with our customized package, or if you just strictly have a certain area that you struggle with, say anemia is one of your issues, and you want to make that weakness a strength, and you just want to book a session to just review that so that we can help you with the tools, resources, and strategies so that you can retain it and feel confident with answering that. You can also book that as a one-on-one session. So if you need us, just contact the nursing studio at 803 400 6864 or shoot us an email at the nursingstudio1@gmail.com. Also, I have added links in the bio to help this access a little bit easier for you guys. But you know what to do. Meet me back here. Happy studying. Bye, y'all.